Hi, I'm Rebekah and I'm a physical therapist based in South Wales in the UK. I work at Baseline Physiotherapy, and the reason I have a special interest in CMT is because I have CMT type 1A myself. Over the course of the next few episodes, in collaboration with the CMT Association, I'm going to be showing you some exercises that you can do alongside your normal physical therapy and exercise routine. Don't feel like you have to do them all. CMT is very variable, so just find a level that's challenging but not unsafe for you. Episode 1, we're going to be looking at balance and proprioception, and the first exercise is standing with a narrow base of support. All this essentially involves is standing with your feet close together, and the closer together your feet are, the harder the exercise is going to be. So if you struggle and need to make it a little bit easier, you can always make the gap in between your feet a little bit wider, or you can hold on to a steady surface. And holding on, you can either do it with your whole hand, just your fingertips, or to progress it that little bit further, you can just use one fingertip. To make the exercise a little bit harder then, what you can do is practice turning your head to the side, or bending your knees, or doing it with your eyes closed. Exercise 2 is called Ramdharry stance, and again you can hold on to a surface if you need to, and with this one you essentially stand with your feet like this. And the same concept applies, where if you have a smaller gap in between your feet, the exercise is going to be harder. But if you are struggling, you can always make the gap a little bit bigger. So you can do it sort of like this, or right close like this. And again, you can do it with turning your head to the side. You can do it with your knees slightly bent. This gets wobbly. And you can do it with your eyes shut. Exercise 3 is called tandem stance, and it's similar to exercise 2, except that you have the heel of one foot touching the toes of the other. Again, you can hold on if you need to, and you can also progress it by turning your head, bending your knees slightly, and by closing your eyes. If you're feeling particularly brave, you can also practice tightrope walking minus the tightrope. So we can come like this, just walking along, and again hold on to the wall if you need to. You can come up like this. And then you can also do it backwards. Exercise 4 is single leg stands. So standing on one leg, again you can hold on. So I'm going to use a fingertip for this one. You can turn your head to the side, you can bend your knee, and you can close your eyes. If you are feeling particularly confident, you can also do that on a wobble cushion or a pillow, just to make it that bit more difficult. And also, with any of these exercises, it's always a good idea to do it initially, time yourself, see how long you can hold it, and then practice it over the course of a few weeks and come back to the timing and see if you can beat your previous time. If you struggle with these exercises, or if they just aren't appropriate for you, then it's always best to speak to your physical therapist. These exercises are meant as a guide, and they don't replace an individualised rehab programme. But I hope they've helped. Thank you for listening, and we'll see you soon.